Hello, everybody. My name is Awade Sule. I'm here to do my presentation on integrative therapy. Um, my patient is a 35-year-old African American female. She presented at the clinic with the chief complaint of depression. She stated, "I'm here for my depression. Have had it for a long time and it's getting worse." She reported her first episode of depression when she was in eighth grade. She stated that her depression started from when she moved from California to Indiana. In 2014, she was on Lexapro for depression. She reports that she has significant impairment in social and occupational and other important areas of her functioning. She also reports low mood of greater than 2 weeks with intermittent situational low, sad months with daily feelings of depression. She reports diminished interest in the things that she loves doing. In addition to this, she reports increased appetite and also weight loss. She also reports low moderate of energy level. She says she has difficulty to maintain sleep and that she wakes up like 3 times at night. She she admits feeling of guilt and worthlessness. She said, in her words, "There's no happiness in my life, no purpose, and there's loss of existence." She reports that she cries daily during the meeting. She lives with her fiance. They are not married. They're planning to get married in November of this year. And she said her fiance is very, very supportive. She said she does not have a good relationship with her mother growing up as a child. And that's another thing that contributes to her depression. She denies any thought of suicide, homicide, or and she says she has no plan. She said when she was in grad school, also she started feeling depression. She's currently working. She has a master's, and she says she works in a farm as a statistician. So that's it. She's an African American, like I said, and with African American, when it comes to culture, they see that they are always very skeptical about the diagnosis of depression because they feel like it's going to give them a stigma. So when she came into the office, she was like, I actually stopped taking my medication because I don't like the stigma that leaves me, and I'm not open to telling people about my depression because I don't want them seeing that I am crazy. So African Americans, they're always very concerned about the stigma. They don't want people to know what is actually, like they have a mental health problems. So with this patient, I'm going to be using three therapies. The first initial therapy that I'll be using with this patient is motivational therapy. The second one is the CBT therapy, which is the cognitive behavioral therapy, and third one is the dialectic therapy, the DBT therapy. But before I go into this therapy, I'm going to try to explain what each therapy actually means. So with the motivational therapy, this therapy we encourage the patient to actually talk about their feelings and what they really want to change now. That's what motivational is. And as a therapist, I'm going to be there to actually provide empathy, to listen to this patient and tell her, to avoid confrontation with her stressors that is actually making her to be more depressed. With the second therapy, which is the DBT therapy that we're going to use, this therapy focuses on acceptance of the patient experience. In this way, I will be able to reassure this patient in a way that okay, you can balance your work and what she needs to do in order to change a behavioral problem. In this therapy, we're going to be using the breathing and health techniques. That's what we're going to be using for this therapy. And the third therapy is the CBT therapy. This therapy, you can use it alone or you can use it alongside with other therapy. This therapy will help patients to become aware of their inaccurate negative thinking, like all those negative stuff that she's actually thinking about that is affecting her. I'm going to try as a therapist to work on her negative thoughts and let her understand that there are some ways she can change her negative thoughts to help her deal with a depression better. So now I'm going to bring my patient in. Hello, how are you doing?
Okay, could be better.
Okay. Before we start, I'm going to get an informed consent from you, if that's okay.
Yes.
Okay, thank you. My patient signed the informed consent. Okay. So what brought you in here today?
I've been struggling with depression for a long time, since I would say my eighth grade. And that started back when we had to relocate from California to Indiana.
Okay.
And it's been on and off since then.
Okay. It's good that you're here. Speaking for therapy session. I'm going to be doing therapy session with you. Okay. The first one I'll be doing is called motivational therapy. And in the motivational therapy, I'm going to be listening more to you and I'll provide you some empathy, okay, for the therapy session. The second one I'll be using for you is called the CBT therapy. In that therapy, we're going to be incorporating you to be saying some positive words to yourself, and let's see how that is going to help. And the third therapy that I'll be using for you is the DBT therapy. In this therapy, we're going to try the breathing in and out techniques, okay? So let's start with the first therapy. So initially, you told me you came in here because of your depression, and you said your depression started in since you were in eighth grade, right? So I want you to introduce yourself to um my listeners.
Okay, I am a 35-year-old African American female.
Okay. And what do you do for a living?
I work with a company. I do have a master's degree in statistics.
Oh, okay. That's good. That's very, very good. Okay. So, your depression brought you here today. So, what has really changed in your depression? Is it getting worse? Is it getting better?
The symptoms that I've been having, it's getting worse, and I'm having a hard time falling asleep or staying asleep. And I wake up like three times at night and then will not be able to fall back to sleep. And I'm irritable. I notice I don't have interest in doing things that I normally enjoy, and it's affecting my concentration at work. And so I took time off to deal with this. It's just, a whole lot of stuff going on in my mind right now, and I cannot shut down my brain to sleep at night.
Okay. I can understand what you're feeling. Okay. I understand that your depression is really affecting you. It's affecting the way you sleep. You can't do what you really love to do any longer because of your depression. So what are you trying to change now?
I just want to be back to my normal self. I want to be able to function without, feeling depressed and lousy the way I'm feeling right now.
Okay.
And hopefully have a better relationship with my mom
Okay.
because she is really part of my problem.
Okay.
And I would like to see that, have a relationship repair.
Okay. So, is your mom living with you?
No, unfortunately, I'm out here in Texas by myself and my fiance. My mom is in Indiana.
Oh, okay, okay. That's good to know. Okay, we're going to try to work on that, okay, and see how these therapy sessions are going to help you. Okay? And I will any other question for me today?
Not really.
Okay.
Yeah.
I will see you back next week. Okay?
Okay.
Okay, thank you. Hello, how are you doing? You're back today.
Yes, I'm back.
Okay, that's good. So how have things been going with you since last week?
I would say I'm getting a little better. Still
Okay.
struggling with the feelings of depression, but it's better than the last time.
Okay, that's good. It's good to know. Okay. So what are the things that triggers you to go into depression? What are the things that actually affects you that actually makes you start thinking about?
I would think just moving on here. I'm by myself with my fiance, all my family members are out in Indiana. I'm lonely. I don't have anybody here, no friend. And being in a new environment, it kind of gets to me. And also my mom, from when I was young, she always thinks everything that's happening to her, it's because of me. It is my fault. And so I don't feel good enough for her, and I don't feel like she loves me really. And that bothers me, makes me feel really sad.
Okay. So what are the events the events that triggers it is you being in a new environment and your mom, the way she always accused you of, causing what happens to her, right?
Yeah.
Okay, so now we're going to try to use some positive talks, okay? Because I need you to understand that whatever we think is what we affect how we feel. And that's how it's going to affect what we're going to let out. Okay. So I want you to see yourself as a very good person. I want you to see yourself to tell yourself daily that, I am beautiful. I can't change these things that is happening. I didn't cause it. Okay. Um, I just have to accept it. I am wonderful. I am not ugly. It's going to get better. I will talk to my mom. I will have a relationship with my mom. Or do you think this is something you can try?
Yes, for sure. I can say those things. I
Okay.
see myself doing that.
Okay, so those are the things that you will say that will actually help you. So when you get home, I need you to make some, write some things on your board, some positive words on your board, and say it to yourself on a regular basis. Okay, and
Sure.
let's see how that is going to go for you. And I'll see you back next week. Any question for me?
How long is this therapy gonna go for?
It depends. It depends on the individual, okay,
Okay.
and how we'll actually progress on this. Okay.
Okay. All
Mm-hmm.
right.
Okay.
Thank you
You're
very much.
welcome. Hello, you're back today. You're looking so bright and beautiful. How is everything going with you?
I'm really feeling better. Now I can, get up in the.
So, how has it been since our last therapy session?
Oh, things have been going on well. Although I still think about the things you tell me to say and think about, I try to keep positive thoughts going. But sometimes, when I'm talking to my fiance, I think about those and it's helping me.
Okay, that's
Mhm.
good. So the positive self-talk is helping you. That is very, very good to know that. So have you spoken to your mom?
I did call her the other day and, it goes the same way. So for now, I try not to confront her with anything.
Okay,
So,
that's good. So,
yes.
so you're using the motivational therapy that we initially started with,
Hmm.
by not confronting.
Yes.
That's good, and you're using your positive self-talk. That is very wonderful, to know that those things are working for you. So when are you planning to go back to work?
I'm hoping in about 2 weeks, my family leave will be over on my sick time. So I'm hoping to go back in 2 weeks.
Okay, that's good. That's good. I am happy to hear that you are hoping, to how you're coping with your depression and also trying to distract yourself. So, what do you do for fun?
I'm not a fun person. I sometimes travel to Austin with my fiance, but I don't have friends here right now. So it's just me and my fiance at home. So I'm not a very fun person.
Okay.
So
I don't like I don't like going out myself either. Okay, so this therapy session we're going to be practicing something called the deep breathing technique. Okay?
okay.
So in this session we're going to breathe in and out. So I would like you to incorporate that whenever you are depressed or when you have a trigger or something that actually make you sad, that any stress or when you finish talking to your mom and you're not getting to a point with her, I just need you once you get off that phone to just breathe in and out. You slowly breathe in and you slowly breathe out. So you do that for about 10 to 15 seconds. So you want to practice that with me? Let's breathe in, out, in, out. So is it something you're hoping to try?
Oh yes, I can do this. That's easy to do.
Okay.
Yes.
So I want you to incorporate that with your other therapy. So incorporate that with, with the not confronting your mom, with the positive self-talks to yourself on daily basis. Always remember that whatever we think is what we affect. Whatever we think is what we affect our emotions. We affect our feelings, and that's what is going to affect our behavior. Okay, whatever we think, it
Mm-hmm.
has a great impact on ourselves. Okay, so try to think of positive things to yourself. That is really, really going to help you. Okay? Any
Okay.
questions for me?
Now I think we covered quite a bit today.
Okay.
I'm looking forward to the new me.
Okay, that's good. And if you do have any question, let me know. Okay?
All
And
right.
always call the office.
Okay.
Okay. Thank you so much.
You're welcome.
Thank you,
Thank you too.
everybody, for listening to my presentation. I hope you all enjoyed this. Thank you, and have a wonderful